The Republican plan to replace Obamacare is soldiering towards a vote on the House floor, but some Republican senators are already saying that proposal would never become law. Now, after clearing the House Budget Committee, Paul Ryan, on the other hand, said this plan is still great policy. That's the politicians. What about the healthcare professionals? Some are sounding an alarm, and NBC's Dr. John Torres has the story.
This is the American Health Care Act.
It took just minutes for major health groups to respond to the GOP's plan to replace Obamacare. Those statements are from groups that represent healthcare providers. But what about the ones that actually put their hands on the patients, the medical boots on the ground? I'm here at the South Bronx, where doctors take care of the most vulnerable patients, the ones everyone worries about. St. Barnabas is a safety net hospital. Dr. Edward Telzak is chief of medicine.
Within the Bronx, it serves among the poorest communities of the Bronx. Very high rates of the major chronic diseases, diabetes, asthma, HIV/AIDS, substance abuse.
75% of patients here are on Medicaid, health coverage they didn't have until the Affordable Care Act. Now they stand to lose it.
Many thousands or tens of thousands of patients who would be eligible for Medicaid at present after 2020 will no longer be eligible for Medicaid, and so will not be able to take advantage of primary care services.
Without Medicaid, poor patients will lose access to what's routine care for most Americans. Things like mammography, colonoscopy, or a cardiac cath procedure to help prevent a heart attack. And one more concern. Medical associations warn that the proposed repeal puts safety net care in jeopardy. This hospital survived 150 years. Is it going to survive this?
I hope so. I hope so.
It's not just poor urban hospitals where health providers are concerned. I've come to small town America where many patients have insurance, but doctors are still worried about what they stand to lose. At a busy family medicine practice, doctors say pricey premiums, high deductibles, and costly prescription drugs are the major concern.
Having access to care is not the same thing as having care.
Their female patients are the ones most at risk.
It's going to affect women disproportionately. You're going to see less mammograms, less pap smears, less osteoporosis care, less contraceptive management.
Moms are going to sacrifice their own care to make sure that their kids are taken care of. So if the kids' coverage goes down, the mom is going to take what she can afford to do and put it into her kids, because that's what we see. It happens in the office all the time.
Though concerns loom large, not every doctor is opposed. They could see higher reimbursements, and patients could have more options when it comes to choosing their coverage. That will depend on the details Congress hammers out. Until then, these doctors remain concerned.
We're the people who've got the boots on the ground, and we feel the effects of this, and we feel the effects for our patients.
Dr. John Torres, NBC News, Cranford, New Jersey.
And the story that the White House tried to declare dead 2 weeks ago when Sean Spicer said there'd be no further comment about those bizarre wiretapping allegations. Well, it turns out his boss didn't get the memo. President Trump back on the topic last night, struggling to explain his sources for the still unsubstantiated claim Obama wiretapped Trump Tower. We have a report on senior Republicans pushing back on a theory that won't die. Also this hour, the wall, not just a campaign slogan. It's in the budget. Trump seeking billions for it, and not from Mexico yet. He's seeking them from U.S. taxpayers. We have a report on the evolution of that campaign pledge and how the debate is actually playing out on the ground in Texas. Stay with us.